Dandruff is a common scalp condition that affects millions of people worldwide. It's characterized by the shedding of dead skin cells from the scalp in the form of small, white flakes. While it's not typically a serious medical condition, dandruff can be embarrassing, uncomfortable, and sometimes difficult to manage. In this video, we will dive into the details of this very common scalp issue, exploring its nature, what causes it, and treatment options. At its core, dandruff is essentially an accelerated shedding of dead skin cells from the scalp. Our skin, including the scalp, is constantly renewing itself. Old skin cells die and are replaced by new ones in a process called desquamation. In a healthy scalp, this process is barely noticeable. However, in individuals with dandruff, this cell turnover process is sped up, leading to the visible flaking we associate with the condition. The prevalence of dandruff is quite high, with estimates suggesting that it affects up to 50% of the general adult population worldwide. It's more common in men than in women, and it typically starts after puberty, peaking in the late teens to early 20s. While dandruff can occur at any age, it's less common in older adults. Causes of dandruff. One of the primary causes of dandruff is a yeast-like fungus called Malassezia. This fungus is a normal part of the scalp microbiome in most adults, but in some individuals, it can grow out of control. Malassezia feeds on the oils or sebum produced by your scalp, breaking them down and leaving behind oleic acid. Some people are sensitive to oleic acid, which can cause irritation and trigger an inflammatory response, leading to increased cell turnover and the formation of dandruff flakes. Seborrheic dermatitis, which is a more severe form of dandruff, is also associated with Malassezia overgrowth. This condition can affect not just the scalp but also other areas of the body with a high concentration of oil glands, such as the eyebrows, sides of the nose, and chest. Another factor that can contribute to dandruff is dry skin. When the scalp becomes too dry, it can become itchy and flaky. This type of dandruff tends to produce smaller, less oily flakes. Dry scalp can be caused by various factors, including cold weather, low humidity, and excessive use of harsh shampoos that strip the scalp of its natural oils. Certain skin conditions can also lead to dandruff-like symptoms. Psoriasis, for instance, can cause red, scaly patches on the scalp that may be mistaken for severe dandruff. Eczema, which is another inflammatory skin condition, can also affect the scalp and cause flaking. Individual factors play a role in dandruff development as well. Hormonal changes, stress, and certain medical conditions, such as Parkinson's disease or HIV, can increase one's susceptibility to dandruff. Diet may also play a role, with some studies suggesting that a diet high in saturated and trans fats and low in zinc and B vitamins might exacerbate dandruff. Symptoms of dandruff. The most common and obvious sign is the presence of white or grayish flakes on the scalp and in the hair. These flakes may also fall onto the shoulders, particularly noticeable on dark clothing. The flakes can vary in size and oiliness depending on the underlying cause and severity of the condition. Beyond the visible flaking, many people with dandruff experience itching of the scalp. This itching can range from mild and occasional to severe and constant. The itching sensation is often described as a persistent tickle or irritation that prompts scratching. In some cases, vigorous scratching can lead to scalp inflammation and even minor bleeding. Some individuals with dandruff may also experience a feeling of tightness or dryness on the scalp. This can be particularly noticeable after washing the hair or in dry, cold weather. In more severe cases, or in instances of seborrheic dermatitis, there may be redness and inflammation of the scalp. Some people describe this as a burning or stinging sensation. In cases where dandruff is caused by or exacerbated by an overgrowth of Malassezia, some individuals report a greasy or oily feeling on their scalp, even shortly after washing their hair. This excess oil can make the hair appear lank and unwashed. It's worth noting here that while dandruff itself doesn't cause hair loss, excessive scratching of the scalp can potentially damage hair follicles and lead to temporary hair loss. Additionally, the inflammation associated with severe dandruff or seborrheic dermatitis might impact hair growth in some cases. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of dandruff. Diagnosing dandruff is typically straightforward and can often be done without a visit to a healthcare provider. The presence of white or grayish flakes in the hair or on the shoulders, combined with an itchy scalp, is usually sufficient for a self-diagnosis of mild to moderate dandruff. However, if dandruff is severe, persistent, or accompanied by significant redness, scaling, or inflammation of the scalp, it's advisable to consult a dermatologist. A dermatologist can differentiate between simple dandruff and other scalp conditions that may present with similar symptoms, such as seborrheic dermatitis, psoriasis, or eczema. During a dermatological examination, the doctor will visually inspect the scalp and may use a special light called a Wood's lamp to get a better view of the scalp condition. They may also take a small scraping of the scalp to examine under a microscope. This can help identify the presence of excess malassezia fungi or rule out other conditions like scalp psoriasis. In some cases, particularly if an underlying skin condition is suspected, a small skin biopsy may be performed. This involves taking a tiny sample of skin from the scalp for laboratory analysis. Treatment for dandruff. When it comes to treating dandruff, there are several practical steps you can take at home to manage the condition effectively. Over-the-counter anti-dandruff shampoos are the first line of treatment for most cases of dandruff. These shampoos contain active ingredients that work in different ways to combat dandruff. Some of the most common active ingredients include: Number 1. Zinc pyrithione. This compound has antifungal and antibacterial properties. It works by reducing the malassezia yeast population on the scalp. Number 2. Selenium sulfide. Another antifungal agent, selenium sulfide, also helps to reduce cell turnover on the scalp. Number 3. Ketoconazole. This is a broad-spectrum antifungal that's particularly effective against malassezia. Number 4. Salicylic acid. This ingredient helps to loosen and remove scalp scales. It's particularly useful for individuals with very scaly scalps. Number 5. Coal tar. Derived from coal, this ingredient slows cell turnover and has anti-inflammatory properties. It's particularly effective for seborrheic dermatitis, but can discolor light-colored hair. Number 6. Pyroxytonolamine. This is an antifungal agent that's becoming increasingly popular in anti-dandruff products. When using anti-dandruff shampoo, apply it directly to your scalp and massage it in thoroughly. Let it sit for at least 5 minutes before rinsing. This gives the active ingredients time to work. For severe dandruff, you might need to use the medicated shampoo daily at first. As your condition improves, you can reduce to 2 or 3 times a week. Also, consider alternating between different types of anti-dandruff shampoos. This can help prevent your scalp from becoming resistant to a particular treatment. After shampooing, you can try applying a few drops of tea tree oil mixed with a carrier oil, like coconut oil, to your scalp. Tea tree oil has natural antifungal properties that may help combat dandruff. If you have dry scalp-related dandruff, moisturizing treatments can be helpful. This might involve using a gentle, moisturizing shampoo followed by a light scalp conditioner. Some people find that natural remedies like coconut oil or aloe vera can help soothe a dry, itchy scalp. In more severe cases, or when over-the-counter treatments aren't effective, a dermatologist may prescribe stronger treatments. These might include prescription-strength antifungal shampoos or topical corticosteroids to reduce inflammation. In some cases, especially for seborrheic dermatitis, topical calcineurin inhibitors like tacrolimus or pimecrolimus might be prescribed. For dandruff that's resistant to other treatments, some dermatologists may recommend light therapy. This involves exposing the scalp to specific wavelengths of light, which can help reduce inflammation and control malassezia growth. Diet may also play a role in dandruff management. Some studies suggest that a diet rich in zinc, B vitamins, and certain types of fats, like omega-3 fatty acids, may help reduce dandruff. Conversely, reducing intake of sugary foods and saturated fats might be beneficial for some individuals. Now, we want to hear from you. Do you frequently have dandruff? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.